Last week, Governor Cuomo's Medicaid redesign team abruptly opposed 79 cost-cutting and reform recommendations, axing more than $2 billion worth of spending from the massive program that provides health care to low-income New Yorkers. This report actually caught many by surprise. Most people had not expected it until tomorrow, so it was 5 days early. The governor and members of the team were very quick to praise the plan, calling the approach of bringing stakeholders together an historic departure from this air war that traditionally characterized the budget battle. However, some healthcare advocates feel that they should have had a seat at the table. Today, members of the Home Healthcare Association of New York rallied at the Capitol, calling on legislators to reject this plan, which they say will cut $700 million in funding to home care while giving special deals to those who are actually sitting at that table, groups like the Greater New York Hospital Association and the Healthcare Workers Union, SEIU 1199. Joining me now to talk more about some disappointment with this plan is HCA President Joanne Cunningham. Joanne, thanks for your time.
Thank you.
So essentially, really the crux of this all is that you guys weren't sitting there.
Well, I mean, that was a big obstacle right from the get-go, that we weren't part of the process. We weren't privy to any of the conversations. And the end result for us is that home care was disproportionately targeted. And if the MRT proposals are enacted as is, you will see, and this is not hyperbole, this is not exaggeration, but you will see a shutdown of New York State's home and community-based care system that the state has put 30 years of investment in building.
We should say that the governor has been taking aim at Medicaid home health care spending for a long time now. So this is not a secret. In fact,
No.
You guys had a target on your back from the get-go. So I'm just reading something that he said. I believe in his budget address, he talked about certified home health agencies getting 26 cents on every dollar, licensed home health care agencies taking the same, the caregiver gets 48 cents, etc. Medicaid is not supposed to be spending more than 50 cents on the dollar. This is not about supporting the home health care industry. That's his main issue. The issue is that your industry is making money off the people that it is caring for.
Right.
Is that not true?
No, it's not. We actually did a whole kind of fact check document on all of the budget messages that the governor singled out home care kind of focusing on. That one in particular, you know, our reimbursement experts and analysts actually couldn't figure out where the 26 plus 26 equation even came from. I suspect that he was referring to what is a administrative cost category in home care, which for this year, for the certified agencies, was actually 20%. And out of that, there's actually a lot of direct care costs that fall into that A&G category. Mm-hmm. Things like scheduling of patients, case management, if I call your doctor to find out, you know, what your condition is, if I'm training your family members to care for you when I'm not there, all of that is considered administrative cost.
So why do you think, if in fact you were targeted, why do you think you were? Is it because you don't yell as loudly as everyone else?
I don't know. I think I yell a lot. Apparently people don't hear me, but...
Well, the reason why I say that is because, you know, look, the governor has been lauded, and he said so himself. In fact, I was sitting in the Red Room press conference when he unveiled this with the members of the MRT team behind him. You were, of course, not there. Mm-hmm. And he said, look, you know, this is historic. We brought people who have a stake in this game, big kahunas of people, right? Mm-hmm. It's really Greater New York, the hospitals, and the home care workers, 1199, the union. And they usually ran all these terrible ads, and they were at the table, and now they're happy, and they're not going to run ads instead against him. Instead, they're running big ads that are for him. This says, you know, tell Albany, adopt the Medicaid redesign team plan that they helped create. And it's not only in the Times, which is what this is from, it's from the Times Union, the Post, the Daily News, and I think the Wall Street Journal. So you guys don't have the budget that these guys spent millions of dollars every year.
Yeah, we don't. We, you know, ironically, we're sort of a small part of the healthcare spectrum and really the healthcare continuum. We don't have resources to run big ad campaigns. We probably weren't a threat to the governor from the get-go. We tried very much to work to advance ideas. We put together 17 proposals, each of which would save money in the Medicaid home care program, payment reform, efficiencies. If I told you some of them that should be no-brainers that would save the state Medicaid program money, you would cringe at the thought that they weren't included. We did all that. We did all of that in the spirit of good faith because we had hoped that the MRT would present a different process, and those ideas were not picked up.
Okay, so, but he says, and that everyone needs to feel the pain. Right? The governor says that. And in fact, 1199 says, and Greater New York say that they will, in fact, feel pain. But then there have been subsequently reports that say that there will, in fact, there are agreements in the MRT plan that are good for home health care workers, not for providers, right? Which are the people who are actually represented by the union. So what will something like a wage floor, which basically says that everyone who is a home health care worker needs to get paid X, what will that do to the people you represent?
Well, you know, we had more than 100 providers from across the state today, nurses. We actually had some patient and family members who actually said, after seeing the MRT proposals, the living wage at this point is meaningless because the home care structure is going to be gone. You know, a living wage doesn't mean anything if the home care agency is closed. The cuts are so devastating, on top of which you add a living wage, which is not paid for. Providers will have to find money to pay for that wage. All of them want to pay their workers as much as possible. We live in a system where most home care providers are 80% Medicare, Medicaid, both of which are controlled payment systems. And most of New York State is not-for-profit health care, including home care. So a living wage, while it sounds like a wonderful thing, that kind of state-controlled wage control for one segment of the healthcare system, a privately held segment of the healthcare system, is unprecedented.
So what do you do now? I mean, the governor said he's going to put these 79 recommendations that were approved with just 4 abstentions last week into the budget amendments. He's going to give it to the legislature. He was quite clear. Pass the budget with this in there as it stands. Your hope is what, then?
Well, we are taking our message to the legislature and asking them to engage. We're not asking for a free ride. In fact, we put hundreds of millions of dollars in payment reforms, efficiencies, restructuring of home care, just ideas that would make the system work better without decimating it. We put those on the table. We're asking the legislature to understand that home care has been disproportionately hit and that they need to help realign those MRT proposals, amend them, change them, reject them, and put other ideas on the table.
Well, there are a couple of groups actually that are after that, and another one is medical malpractice, and of course attorneys who represent them, those sorts of clients. We will be talking more about that on the show at some other point. I want to thank you, though, in the meantime, Joanne Cunningham, for being here.
Thanks.